Thank you so much for joining us, Dr. Amarinder Singh Malhi. I'm just giving your, designation again. You're Assistant Professor, Department of Cardiac Radiology. President, you were the ex-president of the Resident Doctors Association at the very prestigious All India Medical Institute, Delhi. So I'm saying it again for people who do not know and who are joining us. This is India's top institution that offers medical training, research, hospital networks in several cities across the country. So you're really a reference, and you've been sharing lots, not to think that I'm taking over, I'm sharing everywhere on my networks. I think it's really, really essential that everybody shares. Dr. Sarika Verma, thank you so much for being with us again today. You're an ENT surgeon, allergy specialist from Delhi. You're also an environmentalist, super important as well in these cold winter days, as well as a spokesperson for the AAP party that I'm seeing they're sending up very efficient, good information out for the moment. They're sending all this information, the updates, guidelines and things. So the AAP party is linked to Chief Minister of Delhi, Kejriwal. And you also started a petition asking PM Narendra Modi to take action, strict action against those who were attacking doctors. What is the situation, Dr. Malhi? What are you seeing? All the figures you're sharing. Are you worried today?
Yes, a little bit, but because we have got more than 750 healthcare workers, or you can say more than 750 doctors. They are in isolation or quarantine right now. More than 350 in the more than 350 from AIIMS, around 200 from Safdarjung, about 100 from RML, and from Lady Harding, approximately with associated two hospitals, that is around 100 again, and then Sri Guru Tegh Bahadur Hospital, around you can say more than 70 from that hospital, and LNJP, that is the only COVID specific hospital from Delhi. That is around 26 doctors. They are COVID positive right now, and they are in isolation and home quarantine. And from Safdarjung, they have asked for more doctors. They have on the contract basis, the junior residents and senior residents, they have called, they have they are doing the walk-in interview right now. And because there is a lot of scarcity of doctors there in all these hospitals, and because we know that NEET PG counseling, it has to be started from 12th of Jan. Just 2-3 hours back, Mansukh Mandia, our health minister, has told us that it will be on 12th. So we are already 9 to 10 months from the NEET PG counseling. So it will be happening after 10 months. So there is lots of scarcity of healthcare workers, and we can say that Indians, especially Delhi residents, they are having scarcity of doctors and healthcare workers as far as this third wave is concerned.
So I'm worried, because you're saying the third wave, we're saying it hasn't even really, begun, and we're already in this situation. So which is worrisome, right? Because so knowing that you're in quarantine for what, 7 days, you're home isolation for at least 7 days, which is enormous, right?
Actually, 7 days is less according to me. It should be around 10 days, because I am the nodal officer from my department. So if any healthcare worker, suppose any radiographer or any chief technical officer is coming after 8th day, and they are having any symptoms like maybe having fever or mild grade, but that can transmit the infection. So it should be around 10 days. That period is less according to the guidelines from the Ministry of Health and Family Welfare. They should change this guideline from 7 days to 10 days. So we are scared about this thing also, because they're coming in contact with the patients also, and they're coming in contact with the fellow colleagues. So that is worrisome. I'm just talking to a Southern doctor. He's in medicine right now. He's telling that uh, uh, almost all the beds are full right now in Southern. It is not looking mild, but what we are thinking, it is mild. Because if you think that it is mild, yes, we know the symptoms are mild, minimal symptoms as compared to Delta variant and Wuhan Alpha variant. So if you compare these two variants, the hospital admission rate is 10% for first wave for Alpha or Wuhan virus, and for Delta variants it is approximately around 12%. And according to South Africa and from other countries, the hospital admission rate is approximately 1% or more than 1. But now it has increased in New Delhi also. If you see all the figures which are coming later in the evening, the Delhi Delhi government is giving us all the figures and data. So from last 1 week only, it is increased from 1% to more than 5%, 5 to 10%. Now the hospital admission rate is up to that, and most of the persons who are infected right now, they are either they are not getting vaccinated before, and they are only most of them, they are in having undergone oxygenation and the ventilators. So but for those who have got 2 doses of vaccination, their symptoms are very minimal or mild. So that is up to this mark.
What is the rate of the vaccinated people in India right now?
So now
the numbers
for vaccination.
Yes, the people with 2 doses. How many people in India are vaccinated with 2 doses?
Approximately 75 crores they have got second dose. More than 75 crores, you can say. But still, the figure has to reach more than 100 crores. Because if we got 135 crore population, we have given 120 crores for single dose and more than 75 crores for second dose. Still, we are lacking the figure for reaching 70%, because if we give 70% people the vaccination both doses, then only the herd immunity will develop, and then only we can, yeah. So we are still lacking. And one more thing, if we have reminded our PMO, our health ministry, that we should have given the precautionary or booster dose in the month of October or November, because we have sufficient amount of antibody level in our body to combat this infection in this time right now. If we have got the booster dose in November or December, maybe October we have got, because we have started our program in Jan 2021, 16 of Jan, and according to all studies from UK and USA, they are telling that we have got enough antibodies only after 6 to 8 months, till 6 to 8 months, not after that. So from October onwards, the USA, UK, Europe, Israel, they are giving all their frontline workers or healthcare workers the booster dose from October. So our time is also should be around October, so that the healthcare workers which are infected more than 750 in last from 6 hospitals, big hospitals, they should not got that much infection.
Now, do you feel that the healthcare workers who've got infected are because these healthcare workers did not have their booster shot? Am I understanding correctly?
You can say, because if they are getting if they are getting the first and second jab, if you can start from Jan, so already we have 10 to 11 months from that period. So if the antibody level persists, which you can combat the infection, it should be around 6 to 8 months. So we are already behind that period.
Right.
So we should have got that booster dose beforehand, so that will prevent lots of things. Pfizer has done one study which clearly indicates that who has given 2 doses, 30% protection will be there with this Omicron. And if they have given 3 doses, precautionary dose or booster dose, there will be a protection rate of 70%. So according to that study, so if we see that study, It should have been given around October or November.
I just have I'm just making this comparison with France, because now we're saying, like yesterday, today, this morning, that in France we are seeing 35% of Omicron in France. And the other day we heard somebody say that one of our doctors on television said we right now have two waves clashing between the Delta and the Omicron. We've got these two waves clashing. Now, are you finding that as well?
In India, I think the symptoms which are coming right now, they are more than 90% symptoms are because of Omicron, not Delta variant. Because we are already from April 2021 to you can say July, till that period we are in phase of Delta variant. But right now, which cases we are seeing right now in our hospitals or in whole India, that is more than 90% they are from Omicron. Why I am saying? Because we are got scarcity of genomic sequencing labs. We don't have any genomic sequencing labs much in our country right now. In Delhi, only 2 genomic sequencing labs are there. So we are doing these random sampling for these patients. So that's
and whatever
why,
sequencing you're seeing is, for the moment, it's all it's all
more than 90%. More than 90% they are coming Omicron. No role of Delta variant right now in this in India, according to the sources which are we collecting right now.
Right. Dr. Verma, have you also got that feedback? Are you also seeing that, hearing about that?
Yeah, hi Sonia. First, thank you very much for having me here. And I want to put across a few things. One,
yes, please.
Is like Dr. Amarinder has said, we've been asking for a booster for a while now. For the last 2 months, doctors from Indian Medical Association have been asking for boosters ever since the Omicron wave started in South Africa. That's almost 6 to 8 weeks back. And it has come again. And we had enough vaccines. So I don't understand why we've had a delay, but we have had a delay. The good thing is that we know for a fact that vaccines work, because 97% of the people who are right now admitted in hospitals in Delhi and Bombay are those who have not been vaccinated. So that is something that's very good for most people. 97% of the people who are admitted in hospital today are those who have not been vaccinated. So anyone who has had 2 doses of vaccine will obviously also be smart enough to use a mask properly when they're going out, because I expect that they will be a little more sensible and responsible, and they will take COVID seriously. And those are the people who, even though they have a breakthrough infection, they are becoming all right after staying at home. I know many people in my extended circle who are currently under isolation, but their symptoms are very mild. So please understand, vaccines are working and it is wonderful. And I applaud the scientists of our generation that, within a year, within 2 years, we've been able to vaccinate more than half the earth. As of today, worldwide, 50.2% of the people have been double vaccinated. And in India, about 45.4%, 151 crore doses have been given. And 62.7 crore people are already double vaccinated. So that is a very, very big step coming for India. But I request everyone, whoever has not been vaccinated should vaccinate. I got my daughter vaccinated yesterday. She's turned 15. So we got the first dose, and we expect
because there's also people afraid of this, saying, oh, for the kids, what's going to happen? They're hearing things in the US, they're hearing things even in France. We've got a whole anti-vax campaign. In France, we've got 5 million people we need to vaccinate. And people are worried about their kids.
Yes, of course. In Canada, my brother's kids, even as young as 5 and 8, have been vaccinated. And in India, I'm also waiting that, they should open up the vaccination. But I think they're doing it in a phased manner. They're doing the 15 to 18 age group, because that is the children who are going to 10th and 12th. And that's a very wise thing, because they will be taking their boards in person in another 2 months. And that's why I think the government has insisted on Covaxin, because their vaccination would be complete in a month's time. I appreciate the systematic way it's going, but I also think that very soon they should open it for children below above 12, and then again children above 5, so that all the children can go back to school regardless of the number of waves that come and go, because COVID is here to stay. We cannot have school lockdown for more than 2 years. It's affecting their psychology, it's affecting their studies. And there's a very large percentage of children who are not able to take online classes, who are missing out on education. And that is something that we cannot take lightly at this point of time. There are There are about 20% children who have access to internet, Wi-Fi connections and all sorts of things, and they're able to do their online studies. But there's also a large chunk of children who are deprived of this, and we must not imagine that everybody is in the same boat. So we must vaccinate our children very soon, and we must get them back to school, because Canada has been through a terrible Omicron wave. Almost 10 million of them at one point were already, positive, and those are the ones who have been declared positive by the government. There must be a lot others who have done a home test, isolated themselves, and not declared.
Right,
so
exactly.
So you would imagine that at least 50% of the Canadians have gone through this Omicron. They've settled down at home, and India is also currently in the same wave. Yesterday we've had 1.59 lakh new cases. And we have seen this rising exponentially. 3 days, 2 weeks back, everything is fine, and now we are down to 1.5 lakh cases a day. This is the time to sit tight, avoid any sort of unnecessary exposure. Those of you who can afford to stay at home, please stay at home. Those of you who can afford to order online, order everything online. Just try to minimize going out. There are a certain number of people who will have to go out. There are people who have to go out for a living, construction workers and all sorts of people who cannot afford the luxury of staying at home, because their daily bread comes from earning outside. But there are also a certain segment of people who have online jobs, who can move to work from home, their children, their teachers, and most schools have responded well. I'm delighted to note that almost all the parties, despite the Election Commission not banning rallies, all the parties have shown a great sense of responsibility, and they have stopped all sorts of physical rallies in Uttar Pradesh, at least, where the cases were rising phenomenally. The parties have done it spontaneously, and I respect that, because we remember the second wave, that is the Delta wave, happened after these massive election rallies for Bengal and the Kumbh Mela. I remember the horror we've had after that, and I'm grateful. And in fact, I would like to share that Sanjay Singh, the Prabhari of Aam Aadmi Party Uttar Pradesh, he told me day before that we're doing this online session. All of us shared it, and I was delighted to note that the first online rally of Aam Aadmi Party, we had 1.56 lakh people in attendance. So that is like, the reach is a lot more than you would have in person. To get 1 lakh people on the ground is not only expensive, it's also in COVID times a very dangerous proposition. But online, your visibility is good, the reach is good, and you go directly to the people who are interested in you. So I think all in all, it's probably a good way for Indian politics to move. And hopefully I expect that in the next 4 weeks, the peak will go up and come down. And the important point that Dr. Amarinder Malhi had brought about is that the NEET PG entrance exam was delayed by 8 to 10 months. The doctors who were requesting the government to do a rapid counseling were beaten up, and they were arrested by the Delhi police, which was very shocking, because the doctors were not asking for more money. They were not asking for holidays. They were not asking for anything unreasonable. They were just saying that the entire first year PG's seats had become empty, and those positions were not being filled up, and there was a huge gap in medical care. Despite that, the government used force on people who they showered with flowers recently. And there's a disparity in the way they treat. Ek taraf, you have people lighting candles for you, and when the doctors need you, they unleash the police on you to beat them up, which is extremely unacceptable in any kind of a decent society. Right. And this is exactly what they were asking for about 2 weeks back. And had the government listened and immediately done the NEET PG, by today we would have had a whole generation of postgraduates sitting in their first year rounds. But obviously they have taken their own time, and from 6th they have postponed it to 12th. So another 2 weeks will go by the time the next generation of postgraduates enter the colleges, and healthcare will definitely suffer. Now, as you can see, that now they are asking for, they're advertising ad hoc posts. But I just expect that when you run a country and see a COVID wave coming, you would proactively get things on the ground faster, so that your healthcare doesn't compromise and crumble.
Right. So seeing what you're doing in Delhi, Now, this time, see, the focus was on Delhi last time for the second wave. This time in Delhi, I have the feeling that things are looking different, that you're really going fast with bringing out the information. How fast are people following? How alert are people? Are there campaigns on TV? Are there campaigns on radio telling people now this is going up, stay home, all that? Do they have the information out?
A lot of people are telling me that the feedback from the ground is, even though a lockdown has not been declared, markets are shut, only essential services are open, malls have been reduced to half capacity, and only essential services are open. That is the only way to do it. Arvind Kejriwal has just given a statement about a couple of hours back that we don't want to introduce a lockdown. If you show responsible behavior, if you get vaccinated, only double vaccinated people will be allowed to use the facilities, they will be allowed to use public transport. This is only for people's safety, and there's no harm. I mean, at one side we have the economic burden. The moment you shut down something, you have the economic burden of lakhs and crores of people who are going to suffer. On the other hand, if you don't do it and your cases rise and the hospital, the healthcare starts crumbling, then the lives that can be saved would also be lost. Like we saw in the COVID second wave, the people who could have been saved with enough oxygen, they died at home, they died in autos, they died on the road because they did not get oxygen. And we don't want to reach that point. So I would expect the governments to be err on the side of caution, to cut down a lot of non-essential travel, etc. Because if it saves people's life, and we know that it's not going to last more than 4 to 6 weeks, so it might as well just save lives. We can't afford to lose them again and again.
Dr. Verma, I'm going to be very precise on this. It's extremely important what you've said because it's on a political sphere. Then you're also speaking about Delhi. I'm coming to you as an ENT surgeon. Dr. Malhi just told us that the Omicron is like the big thing right now. This is giving particular symptoms. You being an ENT surgeon, I want you to make that very clear of what we're seeing in the big majority of cases. Obviously, I'm not speaking about comorbidity and particular specific things. What are your instructions to people right now?
So as an ENT, I remember the first wave, almost all the patients were coming to ENTs. Sore throat, cough, pain in the throat, fever, and body aches. This is the typical presentation. A lot of patients are also presenting with loss of smell. COVID second wave was different. Delta was directly affecting the lungs without any throat symptoms. But this wave again is causing a lot of body aches, fever, which goes up to 100, 203. So our suggestion to you is, do not panic, stay at home, take an online consultation, avoid going to the doctors if you can, because most doctors now have a proper system of online consultation, because then you are going to risk the doctor and the staff getting infected, and then the clinic will get shut for another week, 10 days. So try to do online consultation as much as possible. Do not self-medicate. We remember last time a lot of people took oral steroids. I mean, steroids, Visolone started becoming in short supply, and because of that, the blatant misuse of medication, we saw that there was then a second wave of mucormycosis or black fungus that shook the country. Almost 8,500 patients needed to be treated for that, and that was again a very morbid condition.
Do you think that could happen? That could possibly happen this time as well?
No, if people do not take steroids blatantly and unnecessarily and without a doctor's prescription, it will not happen. This time there are no antivirals that are being prescribed. There are no injections, and antibody cocktails have already been shown as not working for Omicron. So that's a very expensive therapy. I know hospitals that have been doing that for the previous wave, and that too for immediate. They started within the first 48 hours. So that's a very expensive therapy for something that is most likely going to be a self-limiting disease. So I think there's a little bit of a pharma company push to certain drugs as well. And I think the only thing that you need to take is paracetamol. Lie down 20 minutes on your stomach every 1 hour. Rest. Self-isolate. The moment you get a sore throat, just isolate in your room. Do not step out of the house, and other members in your family can wear a mask if they are around you. And most patients are getting better, unless someone has a compromised situation like a diabetes or a renal failure, etc. or HIV or any immunocompromised. Those are the patients who need intervention early, and they need to check their oxygen saturation every 6 hours. And if it is less than 93%, they must get admitted in a hospital. Hospitals are still not closed. I mean, I know that I'm not getting crisis calls, so I get that's the direct sense we get. Right now, even the data is showing that only 29% hospital beds are occupied. So that means 70% beds are vacant. So there is no need to panic. Please do not get admitted just because you are positive. 97% patients are going to become all right at home. Leave the hospital beds for those who are extremely sick and whose lives can be saved. Last time I remember even the Delta wave, patients who had very, very mild disease and normal oxygen, just because they were in a position of power or in the position that they could afford, they went and occupied the beds. And we had to actually physically audit the beds in the corporate hospitals to get those patients discharged. But in that process, a lot of sick patients who needed those beds died. So I expect more responsible behavior. If you have double vaccinated, you will have a mild disease. Stay at home, don't panic, remain in touch with your doctor on an online basis, and you will become all right. This is another tough wave. It will settle down in 4 weeks' time. Let's just, pray and get over with it.
People, I'm coming to this essential thing where everything begins, because people have somebody who's got COVID in their building, have someone coming at home who's got COVID, and their first reaction, and this is my friends all over India, are rushing out to go do the test. Now, we had severe COVID pneumonia in March 2020 when no test existed. So I had just no test. And doctors were telling us, go by the symptoms. You got temperature, count from day one, that's day one. It will last it's in 2 phases, 7 days, first phase, and day 8, day 15, 16, second phase. First phase is like the flu, second phase can be deeper in the lungs with pneumonia, whatever. Are you sticking to this? Are you telling everyone to go out and do the test? Dr. Malhi, Dr. Verma, what are your views?
The thing is, I think right now the community spread is huge. If you're telling about Delhi only, the positivity rate is around more than 20%, according to the last figure. And today we are expecting more than 22,000, according to Satinder Jain, the health minister from Delhi. He's telling that it will be around more than 22,000. So it is around 25%. So most of them who are doing tests at home, rapid antigen tests who are doing at home, they are not telling the ministry that they are being positive. So thing is, when the community spread is huge, if you are getting fever or you're getting same symptoms like running nose, sore throat, myalgias, a headache, so you don't need any test. You just isolate yourself for till the symptoms last. At least 7 days you should isolate yourself, and from the 8th or 9th day, when your all symptoms are gone, you came out to the public and just by wearing your mask for another 5 days. So there is no need for tests right now. Just take paracetamol for fever and any decongestants, that's it. So
Dr.
no
Malhi,
need to do.
I'm noting that you are not telling people, that it's mandatory to get out of the house, go do your testing, with having people running all over the place.
Absolutely. Why? Because if you are going out, you are spreading, because this virus is more transmissible as compared to Delta variant and Wuhan. I am telling you why. If one person is infected because of Wuhan or the first wave variant, it can transmit to 2.5 persons. And Delta variant, one person is infected, that can transmit to 5 persons. And this Omicron variant, if one person is infected, that can transmit to 10 persons. So transmissibility is very huge. So if you are getting out from your home, you are getting infection to 10 more people. So stay at home, isolate yourselves, get online consultation, and get the paracetamol for antibiotics for fever, decongestants and gargles, and just take routine vitamins. That's it. Stay at home, and then when your symptoms subside, then you can come out. That's it.
Right. So on this, Dr. Verma, you agree on this?
Yeah, there's also another thing. I mean, see, that's not the official stance. The stance is that yes, you must get tested, but Dr. Malhi has given a very practical point. If you have fever, then you just imagine you're positive in the middle of a pandemic. There's no other reason for a URI, and you must imagine that everybody with a upper respiratory infection right now would probably have COVID. So getting tested would, if you go out and infect other people. Also, I mean, last time I've seen the COVID from the COVID waves that we've been through, our limit to capacity is about physical limit to practically do the testing and process the test reports is about 4 lakh per day. We have already reached that level, because if we have 1.5 lakh people positive, that means we are doing 4 lakh tests. Only then we will get about 1.5 lakh positive. So we have reached that stage already. So there is no point in trying, because what happens is even the people who are doing the test, they are also human beings. They're also going to be at very high risk. And if say 10% or 20% of the staff, they get compromised, they get out of action for 7 to 10 days, then the entire system is going to collapse. So the patients who desperately need the test, if they're in hospital, so we must keep that in mind. This should be a rational usage.
I think it's really important that you're saying this, because we in France have not prepared. We, on last Monday, schools opened after Christmas, after the Christmas shopping, the Christmas, New Year's with friends. Even if we said it, people had to be limited. All this started off in November with the Black Friday, with all that shopping for Christmas, and it's been building up. Early December in France, people were told, go take your booster shot, which is going well. We're all good with all these things, but we've got like 5 million people who are just not vaccinated, and for different reasons. And there's people really the anti-vax. So all this has created immense confusion, because our schools have opened on Monday. 2 days later, we had some schools had like 5-10 teachers who were absent. Half the schools now, we have 9,200 classes closed in 1 week. It is not because we're saying that it is not serious, that the volume of people coming to hospitals will not clutter up and saturate the ICUs. And it's the volume that we're going to check in France in the coming 2 weeks, because in these 350,000 people coming, yes, we will be saturating things. So that is what they are worried about. And in India, we're getting this wrong message of saying, well, Omicron, just be careful. But at the same time, you must know that there's a danger of the saturation, which can and will happen in any case. So people are safe. Is that what you're trying to say? One side, they're safe, which is a good thing with the symptoms, but on the other, they should not be out.
They are mild for someone who got 2 jabs, right? The symptoms may be devastating for that person who is not vaccinated, who is immunocompromised, who is having any sort of carcinomas, who is having HIV, where the immunity level is so low, and more than 65 plus, they can get symptoms where that patient can land into oxygen and ventilators. So be careful. Thing is, the COVID appropriate behavior is must for everyone right now. What the Delhi CM Arvind Kejriwal just told right now, that we don't have to shut everything. We just have to follow the COVID appropriate behavior. That is important. But we are not doing that. Indians are not doing that. They are not putting the mask. Whenever the policeman came, they will do that. They will do that. I will put the mask when he came up. They are not doing social distancing. 2 gaj ki duri abhi bhi they are not doing. 2 meters they are not doing right now. Even lots of people are not going for vaccinations. They have taken one vaccine, and they think that everything is fine right now. We don't have to go for second jab. So please go get your vaccination. That will help, and that will not convert your symptoms into severe symptoms. Just mild symptoms will be there if you are getting both doses.
And please make it very clear that if people have only 1 dose in their vaccine, the second dose, if they don't have it, it's of no use.
Yes,
to just have 1 dose alone.
It is It is very, very important to get the second dose. Now we are wouldn't state that we want the booster or precautionary dose. So you at least get 2 doses completely. Then your turn will come after 9 months. So only that person will get the booster or precautionary dose. Those who have completed 9 months after second dose. So just think over it. Go and get yourself vaccinated.
And then there's also the fact that people have to manage the logistics, right?
Absolutely, because Dr. Sarika, you want to tell?
Yeah, it's actually quite surprising that, I would have thought that the moment the vaccination started for everybody, everyone will just line up and get vaccinated, because I mean, I assume that the natural human tendency is to save your life. But it amazes me that even today, I have people in my circle calling me and said, we have not taken the vaccine. I said, which planet have you been living on? I mean, we've all got vaccinated. I got vaccinated last February. I got my second dose. March, I got my second dose. So I don't understand the point in the delay. And now from tomorrow, I'm going to be getting my booster shot. We've all been waiting for it for like 2 months now. Since November, I think doctors have been asking for the second dose, and especially the frontline workers, ENTs, physicians, people who work in COVID hospitals, pulmonologists, people who should have got jabbed at least 2 months back, so that we were in a better position today, not in the middle of a second wave, third wave. In the middle of a third wave, if I get a vaccine, it will be effective after the wave is over. So this, I think, is a delay, and it could have been avoided. See, we have already lost more than 1,500 doctors in this fight against COVID. To give you a perspective, it's more than the number of soldiers that died in the Kargil war, right? This is a war against a disease, and 1,500 doctors have died. And these are able-bodied young doctors who have many decades of progressive life. So not only their families suffer, the entire nation suffers because 1,500 doctors are gone from their lives. So we must protect our resources. We must act sensibly. When you have a COVID active wave, you have to stay at home, stay out of the way, so that essential services can be met. And when this wave is over, you can go back to partying, pubbing, shopping, and life as normal. But if because of your irresponsible behavior, people die, that family will go into darkness for the rest of their lives. So, I mean, I request everyone to show responsible citizenship. Get your vaccines if you've not been vaccinated. Vaccinate your children the moment vaccination has started for 15 plus. And if you are eligible, especially the people above 65 years, those with comorbidities, and all doctors and frontline workers, please vaccinate yourselves. Keep safe. That is the only way to go about this.
And just one last thing, I'm coming back again to the testing. So if you said no, there's no testing at the beginning, you're also saying, please don't go and test at the end feeling, I'm out of COVID, I need to go test because I have friends going and testing, I'm waiting, I want to go test and see if it's finished or not.
The government has a very, very strict policy this time. They have made it loud and clear that you do not get an RT-PCR, do not wait for an RT-PCR negative. After 7 days, you are considered negative. Please do not waste resources on a second test. Do not wait for an RT-PCR negative. In fact, even the moment that the guidelines came out, I sent it to my building RWA also, telling them that reduce it to 7 days because, not every family can manage for 2 weeks without cooking and without outside help. So that also is a logistical nightmare for certain families. So there is no need for a test afterwards. And if you have mild disease, you will become all right. Ensure that everybody in your family gets their vaccines. And if you're eligible, please get your booster.
Dr. Abhishek Singla, tell us again, I've seen that you have home docs, you have your own network of doctors providing services at home. So people do not need to get out of the house. Dr. Malhi, Dr. Verma just explained to us saying that they do not want people going out and getting tested. They want people staying at home and want people, concentrating on the symptoms, knowing that the symptoms are not something like we saw in the first wave, not like we saw in the second wave, and that Dr. Malhi just said that 90% of what you have right now is Omicron is really quite simple. I mean, in terms of mild, it's quite mild, right? In terms of what you're seeing.
Yeah, Sonia, I have seen till now around 50 number of patients of COVID from last 10 days. Some I have got for the teleconsultation, some I have visited there at home. So the best thing of this third wave COVID is the people are having the mild symptoms. Some people call me up, say, sir, मुझे तो ठंड लगी. I got just cold because I went outside. So then I ask them what are the symptoms. Then they tell me, sir, it's a mild cough and a itchy throat, nothing else. No fever, no sore throat, just a mild cough and a itchy throat. What I request them is not the cold, what you're telling, it's the COVID. Just get your test done and keep yourself isolated. Test is important when you are living with a joint family, when other people are not having any symptoms and you are having the symptoms. First, keep yourself isolated and get a COVID test done, so that because psychologically people think that just they have a cold and there's nothing else like COVID, so they move around with the other family members and their friends. So once they get a COVID test done, if it is positive, then the psychologically they have to quarantine themselves. Otherwise, they will not quarantine.
Right. So
That is
you're saying something different. You're saying because we will reach a situation where the labs are going to be saturated and going out is going to be difficult, and we will have, you know, rates of contamination that are going to explode, like in France, where 350,000 people, fresh cases every day. We've broken every single record, and now they're telling us not to go out and to keep an eye on our symptoms at home, you know, like we did in 2020 when we had no tests. When I got severe pneumonia, COVID in 2020, early March, we really had no tests because tests barely existed. They had just come out. So they kept them for the essential comorbid people, for extreme cases, and we were not tested. We were, you know, trusting our symptoms, trusting the fever that we had. So you're saying something different from Dr. Malhi. What Dr. Malhi is saying, he's saying not to.
There is a reason. See, if there's a family of 5 to 6 members, and if one person is having the symptoms, so I request them to get a COVID test done, because I know if the COVID test, they do not do the COVID test, and if they do not see the COVID is positive, they will not isolate themselves. It's the mentality of Indian people. If one person is positive from a family and others people are having the symptoms, I say, think they are the COVID positive. There's no need to test to be done, and keep them isolated. That is the most important, because mentally they are not prepared to keep themselves isolated. Just they think it's a cold. It's a normal thinking what the people are thinking. I'm visiting them. I'm getting a teleconsultation. They said, sir, I went outside, so I got a cold, and it is not COVID. Then I say, do a test, because if I don't say do a test, they will think that it's just a cold and they will roam around.
But when the official news in India is going to say, if you have a cold, you probably have COVID, on national news, if the you know, Prime Minister says this, and all the ministers and officially the government announces it, saying that you maybe do not need to go and do a test. I'm just trying to say, how can we prepare for everyone not to rush to the test in the coming weeks? People are waiting for 3 hours with their kids, with themselves, in front of pharmacies all week. Half the classes in France have just been closing with COVID cases. Now they're telling them not to go in front of the pharmacies and stand in lines and to buy the, you know, the test. Even to buy the test, you got 2 hours just to go buy a test from a pharmacy.
I think so that India is better prepared than this time, because
Good.
believe me, I have a lab also in my clinic, and they are doing many tests. Then also there's no rush in the labs. There's no overcrowded. Still, we are getting the reports in first 24 hours till nowadays also. Okay,
Dr. Malhi, what do you think? Is it the same thing at AIIMS?
Absolutely. We are basically not only for COVID test, for all tests, we have to provide all the reports within 24 hours. So either it is RT-PCR, CBNet, that reports has to come within 24 hours. And rapid antigen test, we will get the report within 10 minutes.
Yeah.
within 10
And,
minutes, rapid
and,
antigen test.
and maximum people are doing a rapid antigen test at home also. They are
Yeah,
asking
yeah,
online, they're doing it, and they are not doing the COVID test if the test is coming for.
Right. So the
yeah.
antigen test is a huge help. It's helping
Yes,
people.
absolutely. Because it will decrease the burden for RT-PCR and CBNAT or TrueNAT. The thing is, if it comes positive, 100% that it is the patient is COVID positive. But if it comes negative and the patient is having symptoms, sometimes it comes negative.
False
So
negative.
thing is, then you have to go for RT-PCR or CBNAT.
Okay,
Yeah.
that's very clear. That's very good. Dr. Singla, what are you seeing? What did you see during the second wave that you do not want to see people do during this third wave? The simple things that we can avoid, the things that we should not be doing, and the things that we absolutely should be doing with the people who are in danger, who have comorbidity, who have problems, and who should be the people coming to your clinics or staying at home for your home services.
Second wave was the nightmare for everyone, for this, for our medical facilities, for doctors, for nurses. It was a nightmare. We never expected, we never thought we would face such a situation. It was a horrible situation all over the world, mainly in India. And touch wood, this time more people are vaccinated. I think so. The symptoms are mild just because we are vaccinated. Maximum people are vaccinated. The Indian government has emphasized a lot for the vaccination. People are vaccinated. I think so. 150 crores people are vaccinated in India, and it's a huge because of the population. It's very difficult for a huge population to get vaccinated, to educate people to get vaccinated. That is the huge movement for India, and because of this vaccination drive, the people are saved in the third wave, and we are having a mild symptoms. That is the
Dr. Singla, how many people are you seeing who are telling you that they have both their shots? Dr. Malhi just said a few minutes ago that some people are very happy that they got one shot. They're not insisting on the second shot. They feel that they're saved, but with one without the second shot makes no sense. Have you got a campaign? Are you pushing people to come get their second shot?
See, in the Gurgaon, I think so. I'm not sure, but I think so. 100% of population has been double vaccinated in Gurgaon, because here the people are more educated and working class, so they know their importance of the life, the families, and all that. So I think so in Gurgaon, 100%, and 100% of the people whom I have seen last 10-15 days, they were double vaccinated.
It's not about the metropolitan cities. I know the Gurgaon people, all the office going people, they are office going people, and more of them, they are educated, and that's why they are getting both the jabs. But the thing is, in the villages, still people are not getting even a single dose. So thing is, the problem lies with the villages, right? So in the metropolitan cities, both the doses have been given to most of the individuals, most of the villages of India. I am not talking about UP, Bihar, or Punjab, or any. So it is most of them, because it all depends upon the awareness and education, and how they will perceive and how will they pretend to get the jabs or not. Still, there are lots of myths, whether they will not get the child, they will get other things. So lots of things are there. So lots of myths are there in the villages, because they're not educated, or that's why they're not getting lots of jabs.
So there's also superstitions, and there's
Yeah,
all these
yeah,
beliefs that people
yeah.
have.
In all the social media platforms, there is lots of awareness regarding vaccination, the COVID appropriate behavior, like mask. You have to wear mask, and especially N95 or AAA surgical mask. Then the social distancing, 2 meters social distancing has to be done. Then the hand hygiene. Every half hourly, you have to wash your hands with soap or sanitizer for 20 seconds, right? And then last but not the least, the vaccination. They have to get the vaccination done, both the doses. But still, lots of people are not following COVID appropriate behavior. They are not putting the mask. They are not doing social distancing. Even they're not most of the they have got the 2 doses of vaccination, but still there are some people are left. That's why. That's why these mutations are happening again and again. That's why the virus is coming to those hosts where, where they are not got the vaccination. Government is doing everything for you, but it's your time, for the time for the general public to do for themselves and for others. Just follow the
Right.
COVID appropriate behavior. That
Right,
is must.
because now as we go, there's more and more things that people need to care about and they need to do. Because first there was the mask, then there was gel, there's washing hands, there's the first shot, there's the second shot, there's being careful about things, not going out. So there's lots of different things that people need to do collectively, you're saying, for it to be efficient, right? And still there will be obviously variants coming because there's international traveling. What's the situation with international traveling right now? Are they going to be closing something? Are they going to be doing something?
As far as international travels are concerned, for time being, they are not. They are testing every individual who's coming and giving them 7 days home quarantine. For those people who are coming, testing has been done for every individual from the international travel. In Amritsar only, in Punjab area, these flights who came from Rome, 176 the individuals came COVID positive from one single flight. So all have been
this was checked at the airport and found
at the
at
airport.
the airport.
At the airport, they have done the testing there, and 176 individuals came COVID positive, and then they have been home quarantine, or they have been quarantined in some hotels or somewhere near the airport. So everything has been done right now.
Right. So which means that Rome should not be sending people onto flights without testing them, apparently, right? I mean, us in
Maybe in
Europe.
between, maybe in between that period they got infections, because some asymptomatic carriers are also there, because they
Right.
have to be in the flight for long flights, and they can grab that infection in between that period. So
Right.
anything is possible.
Absolutely. So people have to really be careful, knowing that when you arrive in India, that the authorities are extremely careful, strict about this, firm about what needs to be done. And at the airport, you can be checked, you will be tested, and you will be put aside while you have the infection, you carry the infection. Do you think that people are going to be wanting to stay for 7 days around and while they isolate around the airports and things? Are you saying this? I'm keeping your words so
No,
that
no,
people
that
know.
yes, yes, they have to be, and they are quarantined.
Very
Yes.
good. So it's good. It's good. So all the people watching this, I'd like the people who are in the groups I'm going to share this with to know that they cannot just go, they cannot be going out, they cannot be just be irresponsible and get onto a flight, come to India, and that nothing is going to happen to them at the airports. Good. It's very efficient. And it's good that we're saying this. Dr. Abhishek Singla, I'm coming back to you regarding home quarantine. Now, we're saying this again and again and again, but we're saying that this virus, in the huge majority of cases, still is not going to send the majority of people to the ICUs, is not going to send the majority of people, I mean, to their deathbed, obviously. We, in the majority, are seeing people recovering at home, treated at home, and in perfect health, perfectly fine, treated at home. So everybody does not need to rush to the hospital. Because you're a specialist and have that service of doctors and facilities at home, tell us a little bit more about your guidelines. What are you guiding people through?
The most important thing is to keep themselves isolated. And I think so the people are more careful this time because they have seen the second wave, so they are more responsible this time. Last, because I have seen last time the people who are irresponsible, those who didn't care of themselves and others, were the most sufferers last time. What I have felt, what I have seen with my patients, those who were careless, those who don't take care of themselves, took medications, took COVID seriously, were the more sufferers. So this time the people are more knowledgeable. Okay, people know what to do this time,
They're
and
ready to make the effort.
right. So they are keeping themselves isolated. That is the best thing. They don't want their family members or the friends to suffer, so they are not moving out much. They're wearing masks. They're doing hand sanitizers, using hand sanitizers and wash. And that is the most important thing. And what I'm telling them is, don't panic. It's just a mild symptoms what you're having, and touch wood. This time the lungs are not getting involved. You're not getting developing complications of like pneumonia, viral pneumonia. So, and oxygen levels are fine, no major lungs issue. That is what, and I'm telling them to take good, healthy, high protein diet and more of liquid diet. That is the most important thing what they have to take, along with supplements like vitamin C, multivitamin, paracetamol for the fever, and antibiotic if the cough is purulent or a yellowish purulent cough, then I'm advising the antibiotics. Otherwise, just a paracetamol, vitamin C, and multivitamin.
And obviously antibiotics with a doctor, seeing a doctor. Dr. Verma said last time people were on auto medication for steroids and going here and there, doing all sorts of things. You are forbidding people from taking antibiotics and doing things without obviously having consulted a doctor first.
So there is no role of antiviral and antibiotics in this
Right.
Omicron wave, third wave. So just we need paracetamol, decongestants, antihistaminics if the running nose is more, and multivitamins. That's it. Nothing else.
So that's super practical. That's really great. That's good. We've got good news. We have the news, which is a little frightening to see the number of people getting infected with the very high level of contagion. So obviously France is now observing for the next 2 weeks. We've seen that in South Africa, in Scotland, and in the UK, the wave is on the decline and the symptoms have been quite mild compared to the other waves. France is not pronouncing itself for the moment. We are not saying anything. Schools have just opened for a week. Till for the next fortnight, France will not pronounce anything, not confirm anything till it studies its own wave and its own consequences in the ICUs and in hospitals, because it's constantly rising daily. We had 2,300 hospitalizations yesterday, which is something we've hardly ever had, or maybe never had. So it's huge, but at the same time, it's considering the number of people who are contaminated, this number of symptoms still in families are, like you said, quite mild. I'm not. These are words I'm using from what our governmental sources are putting out. What you are saying also and observing in India. I'm crossing my fingers for India as well. Dr. Singla, is there anything you'd like to add for the home? Is there anything you'd like to say for oxygen, for, this was a problem for oxygen, etc.? Do you want people to go prepare, go, buy?
Dr. Amrinder also said that some doctors are using antiviral, but I don't think there's any role in antiviral these days. There's a number of medications are coming COVID, but I don't think so. We should recommend people. Many of my doctors having sending the prescription that we are referring the person who's having a high fever. I said that 2 or 3 days the person will have a high fever and it will go by its own. There's no role of the antiviral in this. Antibiotic also I'm using because sometimes I'm founding a patient's having a purulent cough and a severe sore throat. So it's mainly the upper respiratory tract infections are coming, not a lower respiratory tract infection this time. So using azithromycin or a cefixime is best enough, not a higher antibiotics use is must. And I was listening about the children's COVID. Children's are having. See, I have a joint family of 8 members with 2 children of 1.5 years and 3 years, and we are all COVID positive. So we have gone through last week. We all were positive. We only 3 people did the test so that to rule out that we are COVID or not. Other 3 members, 4 members, we didn't do the test, and there were the mild symptoms. And in children, one children was not having any symptoms, and my son is a 1.5 years old. He was just having mild cough and a running nose. So the best thing is that children are not having a severe symptoms, and the natural immunity is working for them. And I don't think so there will be severity for the children who are not vaccinated, because I think so there's the natural immunity what are protecting them. They have protected for the first wave, second wave, and this is the third wave. I hope so children will not be sufferers.
Thank you so much for speaking about your family. If you're allowing me to publish this, it's really interesting and important for me to be able to say this and show this example. All of you are vaccinated. Everybody in the family is vaccinated, right?
Yeah, just
right.
Except the children, all are vaccinated.
Good, great. So this is a typical example of a family where everybody is vaccinated, who's got the Omicron variant, apparently, with the symptoms that we've spoken about, and you're what, fine. It's been how many days? 5 days?
It's been 7 days.
7 days. And so there was very high fever.
My father got the high fever. Others all were having around 100 or 99. My father got 100, 102 for a day or two. Otherwise, it was a mild fever. I just had a cold, running nose. No symptoms for me. My wife has a sore throat, no fever. My child only the dry cough and running nose, no fever. And my brother had fever. My brother's wife got fever. Mother got mild fever. Father's got fever.
So wonderful. This is good news. This is good. I'm wishing you all the best for your health. Obviously, we need all our doctors. Now, just coming back to one last thing before I end, speaking about the runny nose, which is the big thing in France as well, with everybody having a cold. It is cold. It's winter. It's snowing here as well in France. It's really cold. So I'm thinking in terms of practicality. I'm thinking in terms of kids in class, kids in school, everybody with a runny nose. You got the mask on top of your nose, which complicates things, right? So you're touching it. You need to go wash your hands. The kids do not have gel, or they don't have soap, and the hands are full, and they've got the mask. So with the cold and all the hankies and all the dirty hankies, where I mean, obviously this is going to be a bit of a mess. This is a mess. I mean, we are going to see this.
But I think so if a child is having a cold, I think so he or she should be at home only, not be coming to the school.
Right. But in France, you see, our mentality is you give the kid the medicine, and he goes to class, because it's cultural, you know. And people go to work with the flu. So I think with COVID, people are realizing that, no, I have my responsibility in contaminating other people. And I, as a responsible person with COVID, need to sit at home once I'm sick, you know, because it's impossible to handle the mask, the hanky. I mean, it's going to be crazy with what's coming with the kids. So it's important that you're saying this. Thanks a million for being with us. It is so kind. I'm so grateful to you, because this helps, obviously, Dr. Malhi, Dr. Verma, Dr. Abhishek, Singla, because people need this right now. Huh? Thanks a million.